The man who wrote The Art of the Deal, not able to make a deal on health care. The Republicans plan to end Obamacare, coming up short. The bill pulled just minutes before a scheduled House vote because Republicans did not have enough support among their own party. Here this morning, joining us live in the studio, Barry Edwards, political analyst, Adam Smith, Tampa Bay Times political editor, and Dr. Jay Wolfson, a professor of public health and medicine at USF. Guys, thanks for being here this morning. So we just heard the president saying Obamacare would explode. Did he just flat out blame the Democrats, even though there were some Republicans who did not go with him?
Yeah, he did. It's sort of another fictional explanation from Trump. He suggested this is the Democrats are going to own this health care. No, he didn't. He really didn't reach out to Democrats. It's Trump and Paul Ryan and the Republicans that now will own health care.
Barry, what do you think?
I think that the president, number one thing he ran on was repeal and replace Obamacare. He failed. It showed that governing is difficult. This is the first time he's ever admitted that something was tough. And it shows that he did not have a fundamental understanding of how government works.
Doctor, I'm going to pose this question to you. What would the impact have been for people on Medicaid, especially seniors who have diseases like Alzheimer's, dementia? What would the impact have been if it passed?
Well, for Medicaid in Florida, it wouldn't have been that bad because we weren't an expansion state. Our legislature and our governor said we weren't going to expand. But for Medicare and for the population 55 to 65, just before Medicaid, their premiums would have continued to go up very high. Their deductibles would have been very high. And if they removed the basic benefits, then insurance plans would have been able to carve out little pieces of things that they couldn't afford anyway. It would have been increasingly tough for them.
And we talked about you've just mentioned promise, and we know that one of Trump's biggest promises on the campaign trail was that he would repeal Obamacare. That did not happen. So, did he take on more than he could chew?
Well, that was one of his biggest promises. Another one of his biggest promises was he was a guy who can get things done, that Washington is fundamentally broken, and he's Mr. Dealmaker who can finally get through the gridlock in Washington. Well, no, apparently not.
And he says these sophomoric statements like, who knew health care was so complex? How could you not think health care was complex when you've been arguing about it for 8 years with the Affordable Health Care Act? But one of the things that people aren't talking about is he has issued and told the IRS not to enforce the penalty for mandates. So in other words, when you fill out your IRS tax forms, there's a line that says, do you have health care? He's not going to have those rejected if you do that. The CBO said that 14 million people of the 24 million that would lose health care were going to lose it because they wouldn't have to pay the mandate. So those 14 million are probably still going to come off the rolls, which is going to force increases in premiums.
So if he didn't if he wasn't good with that promise, what does that do to his standing? Does it erode his credibility?
No, Paul doesn't erode his credibility. It's not his to do. He couldn't have repealed the law. It's not his job to do that. It's Congress. Congress has to do its job, and the American people have to decide that they're going to get responsible about their own health care and their own lives. We have failed as much as Congress has failed, and it's easy to point your finger at a president or at somebody else. It's us. It's not them. It's we, the people. That's what this is all about, and we have failed ourselves, and we have to stop pointing our finger at anybody else. Trump can say whatever he wants, and we've learned that it doesn't have that much value. Don't listen to what he says. Look at what he does, and then look at Congress that has a job of fixing it. That's their job.
So, Adam, do you agree with that or no?
No, I don't. I mean,
well, you're wrong.
Duke it out.
Because we now finally have a Republican control. Republicans have not shown that they know how to govern. They've shown they know how to fight. They've shown they know how to oppose. They now control the whole ball of wax. We elected them, we the people. It's up to the Republicans to show what they can do.
And some of the Republicans, as we said, wouldn't even be on Trump's side.
Three divisions in the Republican Party, and those are long-standing political and philosophical divisions. They're not going to go anytime soon.
Barry wants to jump in.
And I think Adam is absolutely right. The Republican Party for 8 years really loved the moniker of being the party of no. Now they're having to transition to be the party of responsibility and governing, and they really haven't found a way to do that yet. But one little final thing. Trump's only been in office for 2 months. It seems like a lifetime. He has 3 years
been 60-plus days.
Months left to president. So he can make appointments. He can do executive orders. He's going to get Gorsuch. He's got a lot of things he can do. So he's not a lame duck, and he's going to be around for a long time.
So he wanted to do tax reform first. Should he have done this, or is that playing Monday morning quarterback?
I think he's playing Monday morning quarterback. I think this is something that they thought they could do because the Democrats snuck in Obamacare through their back door by bending some rules 8 years ago. Republicans said, we're going to come in and we're going to do a slam dunk. They were wrong. They didn't think it through.
So should he have
I
titled,
love
like,
to play Monday morning quarterback, and I think
know you do.
And if you do, yes, probably in hindsight they should have. I think in a way Trump paid deference to Paul Ryan, who felt like, well, Republicans had campaigned, had promised over and over again to repeal and replace Obamacare. They needed to make good on that promise. It would have probably been much smarter to do what the White House wanted and start with tax reform.
So will this now die down and they'll go on to on with their agenda, or will we revisit this sometime in the near future, do you think?
Well, I think Trump and I think we're going to see Republicans continue to do all they can to damage Obamacare so that it continues to struggle in a lot of places. So I think it'll ultimately be revisited, but it sounds like Trump wants nothing to do with it, and Paul Ryan is putting his hands up for now.
Mary, you've been quiet.
I think that right for the next few months, they're going to do it on the fringes, like things like with the IRS, getting kids not to sign up so that it looks like people don't want to be in the program. And so they're going to have on the fringes make it look like a failure or actually be a failure so they can come back later. But he's got a whole agenda. He hasn't done anything on his tax cuts. He hasn't done anything on his economic stimulus. So he's got to do something, or is he just the president of mouth?
Right, so it's on to the, well, some would say yes, some would say no. So is it on to the economy from here?
It should be onto the economy. This is not going to go away, though. The plan was flawed to begin with, and they needed to fix it early on. They didn't get around to doing it because the Democrats didn't want to open the door to the Republicans messing with it too much. The Republicans were not interested in fixing it. Maybe they can take an incremental approach, which is a sensible approach. And this is democracy in action. This is the cool thing about our experiment, is what Jefferson told us we should be doing. And it doesn't work all the time. Compromise is difficult to come by. We've had tremendously volatile periods in American history going back to Thomas Jefferson when he was elected by the House of Representatives.
But as we all know, he has a lot of experience in the business industry, in that sector. But as far as holding any government office before, he didn't.
Well, there's a cool line that I heard yesterday on public media that said, Mr. Trump is not used to playing on a golf course he doesn't own.
Interesting.
I want to get one last. If we want to control costs, which is what Obamacare and affordable health care was originally promised, there's only one way to do it, and I'll see what the doctor says, and that's go to a single-payer system.
Barry, Adam, Dr. Jay.
It's not just about controlling costs. It's about improving the quality of health care in our communities. Healthy communities are productive communities. They're economically efficient communities. Obamacare only started to do things about let's pay for outcomes instead of the things that we do. We have to change the way we do health care. It is fundamentally flawed. If we keep on doing it the same way, we're going to break our economy, and people are getting sicker, and we're spending more than any other country on earth, and we get less for the buck.
All right, guys, I'm being told in my ear, we got to go. Thanks for being here this morning. We'll be right back.